So the main issue in stroke in UK is multiple, and the first number is that we need more thrombectomy services. So for me, who is interested in rehabilitation, I think it starts that the earlier we treat, the earlier we limit the lesion size, and that is the primary determining cause of the post-stroke disability. So the first thing we should develop more centers as providing thrombectomy services and round the clock. I think so far only 3 or 4 centers all over UK providing 24/7 thrombectomy services, which is a big loss for an advanced country like UK. The other OECD countries, I must say, they have better developed thrombectomy services compared to the UK. And this is something we need to focus on. And we need more trained people providing the services, more supportive workforces, and so that we can provide them. Very often we see people who would have been acceptable to a thrombectomy services, but we could not offer them anything because they had a kind of postcode lottery, no service was available there, or they presented late when the service, beyond the service hours. So this actually shatters us, the people who treat them daily, and when we see them, oh my God, this person should have been done much better if thrombectomy could have been provided to them. So this is something, it will be my appeal to everyone, the political people, the people in the health ministry should look into this and take into urgently. My organization, British and Irish Association for Stroke Physician BIASP, is working closely in collaboration with NHS people. So hopefully we'll gain some development in this regard as well.